Good morning, CHD, and welcome to Pediatric Perspectives from wherever you're viewing in the world. We are looking at children's health challenges from a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. Back on the show today, Dr. Liz Mumper.
Thank you, Paul. Good to be here.
Dr. Mumper, if you missed her last show, has been a pediatrician for 45 years. She's my mentor. She is still training doctors around the world through the organization called MAPS, Medical Academy of Pediatric Special Needs. She is the author of a new book, Kids and COVID, which we talked in depth at the last show. So go back and look at that. We're going to focus today on chronic conditions in childhood, because I know, Liz, this is a lot of what you've dedicated your career to treating and helping. It's the most difficult thing to do in pediatrics. But I thought it would be fun and interesting to start, you started pediatrics even before I did. I mean, you go back 45 years ago, it seemed like we were very focused on infectious diseases back then. And I just wondered if you might share briefly what you've seen in your career and sort of what the change has been.
Yeah, so I was a resident from 1980 to 1983, and then I spent a year as chief resident at the University of Virginia. And I remember very clearly the faculty there having discussions about how in pediatrics, it was so fun because you could treat an acute illness, something like a pneumonia or an ear infection, and the kids would get better. And so it tended to attract people who enjoyed playing with the kids and seeing this kind of rapid turnaround and seeing how well the kids did. And the contrast was made to internal medicine, where there were a lot more chronic illnesses, things like heart disease or chronic lung disease or cancer. Now, sadly, what you and I have seen, Paul, is that in the last 3 decades, all kinds of childhood chronic illness has increased dramatically. The one that I've been consumed with is the exponential increase in autism. When I was a medical student, we were told that we probably wouldn't see another case of autism. There was a child that had autism at the Medical College of Virginia, which is now Virginia Commonwealth University, and we should all go and see that child. At that time, the prevalence of autism was about 1 in 5,000 children. And now, with the latest numbers that have come out, the prevalence is about 1 in 31 children. And since there's a male predominance, for example, in California, where we have really good statistics, it's 1 in 12.5 boys. So people argue about, well, maybe we're just doing a really good job of identifying these people and the diagnostic criteria have changed. But you and I know that there are many more neurologically ill children today than when we were training. And so I think that at least 79% of the increase is really due to more cases. That's what the best studies that we have suggest. Other things that we've seen increase dramatically is type 1 diabetes. Now, in children, most of their diabetes used to be type 1, meaning that it was an autoimmune reaction where the patient developed antibodies to these specialized cells in their pancreas that interfered with their ability to make insulin. Type 2 diabetes is what usually would happen to people in their 50s and 60s and 70s, where over time they became insulin resistant and their cells didn't respond to insulin. But sadly, we're now seeing 7, 8, 9, 10, 11, 12-year-olds who have type 2 diabetes, which used to be called adult onset diabetes. So I really worry that the amount of sugar that our children are exposed to, the number of processed foods that they eat, and the relative lack of the kind of whole natural foods that people grew up on in the 50s and 60s, that change in diet is really impacting their prevalence of not just diabetes, but obesity, which is another thing that's really increased a lot. In my state of Virginia, about 30% of kids are either overweight or obese. And that is something that's going to predispose them to a lifetime of more inflammation and more chronic illness. We've also seen increases in things like eczema and allergies and asthma. This happens when your immune system gets a little bit out of kilter, and instead of being in balance where you fight infections well and you don't have autoimmunity or asthma, you tend to have a shift to the Th2 type of immunity where you do have more autoimmunity and asthma. And so these are all trends that we've seen. I worry about the increasing exposures to endocrine disrupting chemicals, to plastics, to glyphosate. You know, we can't tell by just doing a physical exam on a child how well their liver enzymes work or how well their detoxification systems work to protect them from all these new chemicals and pollution exposures. So our kids have got a tough time these days, and probably well over 50%, based on the best studies that we have, of our children nowadays have at least one chronic condition. Chronic meaning that it's not something you get over in a few days like you would if you had a cold or another virus. So that's the sad landscape, and I'm sure you have seen it too.
Absolutely. So if you're watching, if you have children or you have friends who have children, you've probably seen or heard of kids who are struggling with autism or ADD, ADHD, or anxiety or depression, all those neurological things, the developmental delays, the learning disabilities, etc. And then we're seeing this whole host of allergy and autoimmune conditions, as you mentioned, Liz, the asthma, the eczema, and so forth. It's really epidemic, and you've touched on some of the reasons: toxins, and lack of proper nutrients and sort of wholesome living. I'm just really curious, just to get right down to the nitty gritty. If I'm thinking about having a family, I have lots of children, and they've started having kids now. I know you have grandkids as well. But if someone's thinking about starting a family, I've heard that generation say they're afraid to have kids.
Yeah, the millennials are afraid to have kids. And, you know, part of it is that they're worried about bringing a child into a world that seems as screwed up as ours sometimes does, both from a pollution standpoint and sometimes politically for socioeconomic and political reasons.
Right.
But I do think that if you're thinking of having a child, you really need to work at least 6 months to a year pre-conception to really try to clean up your own diet, eat as organic as possible, try to make sure that you're not getting your yard sprayed with pesticides and not getting your home sprayed for bugs, looking at your cleaning products. We all are potentially at a tipping point where our evolution into using all these extra products that we never saw before is outpacing the evolution of our body's ability to adjust and change and detoxify them. So start 6 months early, at least. We would want the mothers to be taking good omega-3 supplementation, make sure their vitamin D levels are in an optimum range. That would be more than 50 nanograms per deciliter, not just the more than 30 that is the cutoff for normal in most labs, because you want it to be optimal, not just barely enough to keep you from getting rickets. And we would want them to have good B vitamins and the right kind of B vitamins. We advocate using not synthetic folic acid, but using a methylated form of folinic acid, because that's very important for a lot of the biochemistry that helps protect the child from not just spinal tube defects, but other problems with their biochemistry. So start early. And then you have a lot of decisions to make about how you're going to birth your child, whether you want to use traditional obstetric care or whether you want to try to do a more natural birth with a midwife or potentially even at home. And then, Paul, one of your passions, and I have supported you completely in your investigation of the role of vaccine decision making. Should we talk about that a little bit?
Oh, I can't help but talk about it. I'm no longer licensed, so I'm not giving medical advice, but I'm also free to tell you the honest truth, which is part of why I love this Pediatric Perspectives platform. I would add to what you were saying, Liz, with pregnancy. Doing vaccines in pregnancy is a grand experiment. None of them were tested in pregnancy. And in fact, I've looked over some of the data used where accidentally someone was pregnant, they didn't know it, and they got a vaccine, and it's not good. I can say with confidence, it is not a good idea to vaccinate when pregnant. It is absolute insanity to give a newborn a hepatitis B vaccine when mom doesn't have hep B.
One of the things that has always worried me is that we know that this thing called maternal immune activation is a risk factor for autism and other neurodevelopmental problems. So when you're pregnant, you naturally want to be in a little bit of an immune tolerant state, because if your body recognizes your fetus as foreign, it will try to attack it or get rid of it. So your immune system has this exquisite dance it does where it tolerates this new body that you're making from scratch. And it's taking a lot of your calcium and zinc and other nutrients to do so. When you give vaccines, I'm very concerned that that tends to have the potential to hypersensitize or overactivate the mother's immune system. And that, I think, is more of a risk in this day and time than the diseases that the vaccines purport to help. And one of the most common vaccines that's given in pregnancy is the flu vaccine, which honestly never really has that good of a track record in terms of actually preventing the flu. And we know that when we give children flu vaccines, they're actually more likely to get other types of respiratory infections as a result of having had that shot. So I also am very concerned about vaccines in pregnancy. Now, you and I both, as we have aged and watched this generation of children, the more we know about vaccines, the less confidence we have in them. And we know that typically they're not tested against a true placebo. A placebo should be something that's inert, like an injection of salt water. But typically vaccines are tested against other vaccines. So you're already building in whatever side effects could happen from those other vaccines. We've also never really tested vaccines in combination with one another. So one of the things that has grown out of your work, Paul, is the evidence about if a child receives 4, 5, or 6 vaccines at one time, the aluminum load not only is a high acute, meaning right away a high level of aluminum, but it also causes chronic elevated levels of aluminum. And aluminum, like mercury, both are known neurotoxins. And so at a time that the child is building their brain, that very important time in the first year of life, I am very hesitant to give such a big aluminum load. And that's why you and I both looked at doing modified immune schedules back actually like 20 years ago now. It seems like it was just yesterday, but you've been telling me that you feel like now that your vaccine friendly schedule and my modified vaccine schedule aren't friendly or modified enough.
Right.
And
I agree completely. You published a paper that really got my attention way back. Was it 2015 or something like that, where you had no autism in your unvaxxed population?
Yeah, I think that was more like 2011 or 12 or 13, somewhere in there.
So, yeah. Oh, that's right. Because it was 2015. I tried to publish the same design study with, I had a larger subset, and the journal wouldn't accept it, wouldn't even look at it.
But
So it was
you
very,
had like 1 in 795 or something kids with autism. So your numbers were even better than mine. And um, your papers and my research has led us to the conclusion that looking at vaccine schedules, our more heavily vaccinated kids are more likely to have a whole host of about 13 different medical chronic conditions. And so I do think that in the new administration, and I think that the Secretary of Health and Human Services is very interested in doing this, I do think we need to look very carefully at that data and not accept the mantra that vaccines are cleared. They aren't associated with chronic illness. They aren't associated with autism. That has been a bit of propaganda, frankly, because when you really look carefully at the evidence that led those people to make those statements, there are a lot of holes in the evidence. And if we could go into it in detail, we could sort of deconstruct those arguments.
yeah,
But that's beyond what I think we're going to do today.
I think you're right. But I mean, you as a, autism expert, trained other doctors on how to manage this. You ran your own Rimland Center where this is the population you were primarily working with. You undoubtedly saw, as I did, hundreds of families where they would have one child with autism. They would then, and they saw, many of these families saw that happen right after vaccines or shortly thereafter. And when they had a subsequent child, they didn't want to vaccinate, right? It's like, no, I'm not going to do that to another child. And what did you see in terms of the health of siblings who were unvaccinated if they had a older sibling who had a vaccine injury such as autism or whatever?
I can't think of an example where the unvaccinated child was not the healthier sibling. They typically did not develop these chronic illnesses that we're talking about in terms of eczema and asthma and autism. So it is very profound. I will tell you, I looked through all my charts to look at the patient histories, because you and I were both taught that taking a very excellent comprehensive history is the best way to figure out what's going on with the patient. And 23% of my patients reported that it seemed like their child deteriorated after the MMR vaccine. And then I had about another 25% of my patients who thought that it was a whole bunch of vaccines given at once at a time when the child was already ill. So back in the 90s and 2000s, the Academy of Pediatrics was advocating that if you saw a child for an ear infection or RSV or an asthma attack, whatever the case might be, if they were overdue for vaccines, you should take that opportunity to give them a vaccine. I never thought that there was scientific justification for that because your immune system is otherwise preoccupied when you are in the midst of an acute illness. But nonetheless, there was this grab them and stab them campaign. And I think that especially if multiple vaccines were given when a child had an acute ear infection and was being prescribed antibiotics, or if they were in the midst of some type of respiratory distress, I think that's something that needs to be looked at very carefully because parents are excellent observers of their children. They know what their typical feeding patterns are like. They know how well they sleep or not. And they should be believed when they say something has changed. And we shouldn't write it off as just a coincidence that the symptoms started the day of, the day after, or 2 days after a bunch of vaccines were given. We need to take the parents seriously.
Absolutely. I remember that push to just catch kids up if they're behind, or any missed opportunity is a tragedy. You've got to, the pressure to vaccinate was just so huge. I think it probably continues. I've met several families whose babies, infants died right after a vaccine because it was done against their wishes, really, when their child was sick. So sudden infant death, infants dying, is very temporally related to when vaccines are given. I've got a chapter on that in my book, Vax Facts.
You know, it's so interesting the way our perspectives color what we see and analyze, because for so many years, sudden infant death you would hear the story that the child had gone to the doctor the day before and that the checkup was fine and that the baby seemed really healthy. And then they died the next day or 2 days after. And it was sort of presented as this type of puzzle. Oh, how could the child be perfectly healthy and then some unknown factor intervened and took the child's life? Isn't it interesting that we didn't do what we would typically do and say, wow, well, let's see, the child was well one day, got sick the next day. What was different? Was he exposed to someone who was sick, or, did he have an accident? Or, we would ask all those questions if a child came in with a broken leg or a new illness. But with SIDS, it seems like one of the good questions would be, did the doctor do anything that potentially could have contributed to the child's death? And the temporal significance of the way SIDS clusters so quickly after vaccines, and Neil Miller has done a lot of work on this, is highly suggestive. And then we also have plausible modes of action by which vaccines can interfere with mitochondrial function and cause oxidative stress to the infant. So I think that there's going to be a rethinking of the etiology, the reason behind SIDS, if we look carefully at the data. And I hope that happens in the new administration also.
Yeah, I would think that would be a really easy one. If they have access to medical records, you look at all the infant deaths and you look at what happened in the week prior to that death as far as any medical procedures goes, or, doctor's visits, so you can kind of get an idea of what was going on. There are about 20,000 infant deaths in the US every year. And I'm just thinking back, you and I have history of decades of being in pediatrics. Back when we were younger pediatricians, there were a lot of deaths from infectious diseases. I mean, you and I treated meningitis and sepsis. How many kids would you guess? And I didn't warn you about this question, so you may not have a guess, but I get the feeling like there's not that many kids who are dying from the diseases for which we have vaccines. What's your feeling on that? I mean, measles, pertussis, tetanus, diphtheria, polio, you name them all, right? The actual numbers of deaths are quite low.
Yeah, I think you looked at that in your book very carefully, because you looked at the risk of death from the illness itself versus the concerns about the shots. I have only had one child in my practice who died with SIDS, and I do think it was a baby that died within several days of vaccines. I have not had a measles death. I have not had a pertussis death. I have not had a tetanus death. So one of the arguments is that we're not seeing all those things now because the vaccines are so effective. But I think we also need to look really critically at that. Unfortunately, just to take measles as an example, one of the things that happened with measles is that once we started immunizing infants at either a year or 15 months, 18 months, various ages over time, and then again at kindergarten, because some kids weren't immune from the first exposure, what happened is that we took measles out of circulating in the population, where not only did other kids get measles, typically do well with it and then have lifelong immunity, but our young mothers started not being immune to measles by the time they were old enough to have babies, and then they would have to get boosted either before or after pregnancy. I wouldn't give ever a live vaccine in pregnancy, which measles vaccine is. But in some ways, you kind of get stuck with that history of altering the natural course of what would have happened historically without the interventions of the vaccine. So it's a bit complex when you try to figure out where to go from here.
You would have to throw that wrench into the works.
Yes, I would.
the measles, matter when any child dies, and my heart goes out to any parent who's lost a baby or a child. You always used to hear any death prevented by a vaccine is worth preventing, but you've got to counter that with the other side. Any death caused by a vaccine is worth preventing. And that's where you and I really focused on informed consent. The risk of death from the vaccine is now greater than the risk of death from the disease for which you're vaccinating. And that's true for every single disease on the childhood schedule. So that's just looking at death. And you and I, we started off this particular conversation on all the chronic conditions,
Right.
many of which are triggered by vaccines.
That's true. And we have several independent practice-based surveys and clinical research that is replicating one another's findings and finding the same thing. Yeah. And
Yep.
Paul, this might be a good time to mention to the audience that if they've heard about the two beautiful little girls, one was 6 years old and one was 8 years old, who died allegedly from measles, that upon exquisite examination of their medical records, they actually did not die from measles. They had other treatable bacterial conditions that were not recognized early and treated enough. So I don't want people to assume that what the mass media said was true and that they should be counted as a measles death. I very much don't think that that was the case.
Agreed. I listened to those reports done by Ben Edwards, the pediatrician on the ground there, or family practice doc on the ground, and also Suzanne Humphreys and Pierre Corey did detailed analysis of the medical records. Those kids didn't die of measles, which means we still have not had a child die of measles in the United States for the last 2-3 decades, 20,
Right.
30 years. Measles is not as deadly as it was back in the 1800s. It was largely gone, not completely, but largely gone by the time that vaccine was introduced. You covered in our last episode the key things that parents should do. The toxins in our world are everywhere, and it does matter. What can parents do to minimize that?
Yeah, so one thing is if you're thinking about buying a new house, try to find one that doesn't have lead. Houses that were built before 1957 often use lead-based paint, and even if they've been painted over, there may be chips in the soil that an infant would play in that could be dangerous. Try not to get a house that's been flooded or that is going to have mold damage, because we're finding that mold in children often starts a chronic inflammatory response syndrome that can be very difficult to identify and treat. I mentioned avoiding pesticides both on your yard and inside your house. Try to use natural cleaning products rather than ones that have 15 ingredients that are largely chemicals. Feed your child nutritious whole foods. Really try to stay away from fast food and ultra-processed foods. We know that one fast food meal is going to elevate inflammatory cytokines. These are messages that tell your child's body to be inflamed, to be hot and red and swollen. And that lasts for hours after a fast food meal. So especially if you have a child with any kind of chronic illness like asthma or eczema, you want to be careful about avoiding fast food. There are some kids with eczema, for example, which is an allergic skin condition, that are going to do better if they don't drink dairy products or they don't have wheat, which has gluten in it. There are real concerns about the glyphosate that is now in many of our agricultural products, especially corn and wheat. So you might want to avoid those. Other things that I think are important to avoid are too many vaccines too soon or for not the appropriate indication. Please resist the pressure to do the COVID vaccine. After doing such a deep dive on that, I researched and wrote that book over a period of 3 years. I just am convinced that it's more harm than good for any pediatric patient.
Yep, I couldn't agree more. And I wonder what you think about acetaminophen, Tylenol products.
Yeah, so acetaminophen has an unfortunate characteristic of depleting something called glutathione by about 30%. Now, you've probably never heard of glutathione. It's our body's major intracellular antioxidant, meaning that it helps fight something called oxidative stress, which children are going to be under if they're sick or if they're in a car accident. It really helps the lining of your gut. Your gut is your seat of your immune system. And if the gut lining is interrupted, you're more likely to have food allergies and to not recover from acute illness. Glutathione is also very important for mitochondria, which are the powerhouses of the cell, the sort of basis for your cellular biochemistry. It helps balance your immune system, and it is the gateway to detoxification. So it's kind of a paradox that we would give something when kids are sick that would impair so many important functions. And in general, my favorite treatment, honestly, for fevers is to sponge the kid off with a cool wash rag or to put them in a tepid bath. That's nature's way of cooling you off. You don't necessarily have to have a prescription medicine. But furthermore, for me, fever is your friend, not the enemy. Fever is telling you there's something going on with your child and you need to try to figure out what's causing it. But low-grade fevers, fevers up to like 102.5, I don't think even really need to be treated at all, because we know that that's part of the immune response and that's a way of responding to whatever virus or bacteria the child is having. So don't feel like you have to treat every low-grade fever, and use acetaminophen with caution. I also worry about too much ibuprofen, which would be Motrin or Advil, because that can be hard on the stomach lining if your child takes too much. So just be aware that some of these things that are taken as accepted practice aren't necessarily the things that you want to do. And I definitely, if you do choose to use some vaccines for your children, don't pre-treat with Tylenol. Doctors have told people to do that for a long time. So at the very time we're giving an injection that has adjuvants in it, meaning other ingredients besides the active ingredient, things that are put in either to preserve the vial or to provoke an immune response, that's not the time that you want to be cutting down the glutathione production by 30%. So don't pre-treat or over-treat with acetaminophen around vaccinations.
Yeah, I'm just going to come out stronger and say, get rid of it. Get it out of your house. No Tylenol products, no acetaminophen. And it would be a rare moment that you would possibly want to use it. So there you have it on that. So you can have a healthy child today. If you are of the childbearing age and you want to have kids, we've given you a whole lot of food for thought. And Liz, thank you so much for all this information. I'm gonna let you have the last word, whatever you want to share. And I'll be glad to hear that.
Yeah, I just want to give a shout out to parents to trust your instincts. Maternal and paternal instincts have been honed over many generations, and it's a new thing to feel like you have to look up on the web every time you notice something about your child and defer to the experts that are writing on the internet. Follow your instincts. You know more than you think you do on an instinctual basis. And you also know your child better than anyone else. So if you feel like your child is different or not acting normally, any clinician that you take your child to should start out by taking your word for that and trying to work collaboratively with you to help figure out what's going on and to develop a treatment plan with you that you feel comfortable with. So feel free to ask questions. If you feel like your questions aren't adequately answered, then maybe you need to look at a clinician who would be a better fit for you and your family.
That gut instinct, that intuition, that mommy or daddy knowingness that you have, that's a little voice in your head maybe that's saying, I don't feel comfortable doing this, then don't do it. Just there's always time. When it comes to medical procedures, something like a vaccine as an example, you can't take it out once it's given. You can always wait and pause and study and think about it and come back later if you decide you want to do it. Thank you for watching. Thank you, Dr. Mumper, for sharing all this wisdom with us today. And folks, if you have any questions whatsoever about COVID, I highly recommend this new book that's coming out. By the time you're watching this, I think the book will be in bookstores. I can't thank you enough, Dr. Liz Mumper.
It's a pleasure, Paul.
Thanks for watching, folks. I look forward to seeing you next week. You can find me at kidsfirstforever.com. I coach, and I also have a book, Vax Facts, that will really give you all the information you need if you're thinking about doing vaccines. It covers pregnancy through old age. Thanks for watching. See you next week.
Now, how old are you?
I'm 19.
You're 19, okay. And this is another Gardasil story.
Yes.
All right, let's first of all tell everybody who you are.
I'm Jacqueline Duncan.
Jacqueline.
And I'm her mother, Christine. Yeah.
All right, let's do it. Let's hear it.
So, boy, I don't even know where to start. Jacqueline was a dancer. I actually brought some pictures today so that you can see the before and after Gardasil. This was Jackie when she was about.
This is modern dance, yeah?
All kinds. I
She
did
did
everything. Yeah.
ballet.
Look at you.
She taught the little girls. She also was a singer and an actress.
That is so cool. You
Thank you.
did that.
This is how she spends most of her days now.
So you're bedridden most
Yeah.
of the time.
She's susceptible to a lot of things. So if somebody has a cold, she might get pneumonia. She gets very, very sick being around, other kids. So she can't be in environments where there's a lot of people because her immune system is so worn down.
So you can't dance anymore at all?
No.
No, and it's
It's
the one
been
thing-
hard.
Yeah, she misses it a lot. She was
Especially as all your friends.
Yes.
That you used
Yeah.
to dance with.
I was
all
on
the-
a team, a travel team, so we would go and compete every weekend, and I was dancing I'd go to school, then I'd go to dance at 2 o'clock, and then I'd dance until 10 o'clock at night every single day. Yeah.
Yeah, she was very, very busy. She was a straight A student. She had a ton of friends. She was very, very well liked. This was after they took all the blood to figure out what was wrong with her. She almost passed out from that. And this was after a simple laparoscopy. She had a ovarian cyst that had to be removed. And her pain was...
After the Gardasil.
Yes,
Yes.
after the Gardasil. And her
How
pain
many
was
times
so
are we
severe.
hearing about these ovarian cysts?
Yeah.
Seriously.
She'd never had any before, beforehand, and that was a simple.
just put them
You
here.
can, yeah,
I'll give them back to you.
that's fine. So she was doing really well in school, and she was really popular, and she actually had auditioned with Disney, and they wanted to fly her out to California, and she had a very promising future, and
What did Disney want to fly you out for?
They were doing casting for different shows and stuff, and I was in the top 13 out of everyone in the country, but I wasn't able to go. I don't do any
You
acting.
look like a Disney princess.
Thank you.
Oh my gosh, you have no
Yes.
idea how much that means to
hair.
her because she loves
I love Disney princesses. Yeah.
Well, when you come to our summit, you can be the Disney princess.
Okay,
there.
perfect.
Okay?
Yes.
Yeah. There's a lot of children that are going to want their photograph taken with you,
Yes.
Disney princess.
I'm okay with that. Yeah.
Okay, good.
Love that. So when she was, this happened in 2011, she had around middle school, she started to get a lot of strep throat. And she'd always had strep, but it was just more cases of it, more frequent. And she started to get tonsil stones. Her tonsils actually started to form stones in them from all the scarring she had from the strep. And she was getting sick, and so we went to the pediatrician on a routine visit, and the pediatrician said, "Are you going to get the Gardasil vaccine today?" And I said, "I don't."
This is the first one we're talking about.
The very
So
first
she was
one.
sick again. Another person that was sick when they
Yes.
went for their Gardasil vaccine.
Yeah. And so I said no, because about a month or so before that, she had injured her knee or something in dance and had gone to a physical therapist who had said, have you gotten the Gardasil vaccine yet? And I said, no, she hasn't had it. And he says, well, I'm seeing a lot of girls that are coming in with injuries from the Gardasil vaccine. And he said, so please do your research on it. So when the doctor asked whether or not she would have the Gardasil vaccine, I said, no, we'd like to take some time to research it. Well, she kept going back in for strep or tonsil stones, and the doctor probably 5 or 6 times kept asking about whether or not we were going to get this shot, and I kept saying, no, I still haven't done my research. One of those times, however, I was not able to make the appointment, and my husband took her. And the doctor asked, and my husband said, I'd rather wait for my wife. And the doctor said to my husband, oh, so you want your daughter to get cancer? And he loves her. So it's a decision that as a parent you can't forgive yourself for. We had no idea. So she got the vaccine, and instantly she had some dizziness. She was tired. Her arm hurt a little bit. But no doctor had mentioned that it could possibly be from the Gardasil vaccine. And a month later, she had a tonsillectomy for the tonsils. And when she had the tonsillectomy and she came out from that tonsillectomy, her anxiety was so bad she had to sleep with me. She had night terrors and couldn't sleep at night. She took 3 months to heal from a tonsillectomy that should take about 3 weeks to heal from. And nobody could figure out why it was taking so long and why it was so hard for her. So then we started seeing doctors because she couldn't go back to school. This child who couldn't wait to go to school and was popular and well liked by teachers couldn't go to school and was in pain and didn't feel well and wasn't healing. And
did you have to stop dancing at that point as well?
Yes. Yeah, and that was really hard. Yeah, and I got a lot of criticism from my friends, people like my principal, teachers, my dance team. Everybody they would say I was faking, and I didn't know what was happening to me, but I knew that something was wrong. And I've never been in that type of state. I'm always wanting to be social, and I love dancing. I would never want to give up dancing ever, and I could not do anything. I couldn't even go to the grocery store. So it was difficult to have everyone kind of attacking me and telling me that it was all me when I didn't want this. This was not the way I wanted to live my life.
This is incredible to me how friends and family and so-called loved people in our life, dance teachers, whatever it may be, turn on the victim of the Gardasil injury.
Because I don't think anybody knew. And it was like I couldn't even understand, why aren't you going to school? Is there something wrong that you don't want to, why can't you go to school? I didn't understand. My husband didn't understand. And we started getting pressure actually from the school. They would call us and say, why is your daughter not here? So we started looking for help because she was in a really bad state. She would have these rages that were not like her at all. And I don't know if it's okay with you that I share about. Okay, so she started self-harming, which she had never done before. At one point, she had cut her arm 32 times. And I had no idea what was happening to my child.
And what was happening? What was making you do that?
I had so much anxiety and I was so deeply depressed. That time when I think back to it, it just feels dark. I would never left my room talking to people. I was just out of it. I felt completely out of it. And the only way that I could cope with the amount of anxiety and stress and depression was to cut. And it was it would relieve some of that. I felt like I could breathe a little bit. But it would come on so strong. That's the only way that I could handle it.
Had they put you on any psychotropic drugs?
Yeah.
Yes.
Because initially
that would be one of the problems without a doubt. The side effects. Have you seen the side effects of those drugs? And so actually what ended up happening was for 2 years they had her on those drugs, and she wasn't doing better. She wasn't getting better. And so
finally her psychiatrist said, she's not getting better. There's something else going on here, I believe. And around that time, actually, we didn't know this until we started looking and piecing this together. I mean, I want you to understand that for us, this has all just come to light in the last month. We're just now finally realizing that it's Gardasil.
And why is that? Why have you only just finally realized?
Because the CDC tells you that vaccines are safe. And you believe it. You believe that that's true. The doctors never mentioned Gardasil. They never mentioned that that would be what could harm my daughter. Nobody ever said, this is what's taking your daughter's livelihood away. This is why she can't dance. This is why she can't go to school. Nobody ever said that to us. And so when you don't know that that's what's happening, you're lost.
Right.
So we saw these doctors, and she went through, psychiatric treatment, and we did these things, and she wasn't getting better. And in 2013, and we just found out that she had the second shot. I don't remember ever agreeing to it, but they gave her a second Gardasil shot. And that's when the wheels fell off.
And when did that happen?
That was in 2013. Mm-hmm. That was around her junior year.
And so you've only ever had 2?
Yes.
Yes.
Thank God.
Yes, because I think if she had the third, she probably would be in a wheelchair.
But that doctor that I had, every single time I went in, she was like practically shoving it down my throat. She was like, you have to do, and I'd be alone with her, and she would tell me, like, to make me feel guilty, it's my decision. And, I was young. I didn't know anything about this, so I just was like, okay, I just agreed to it. And the way that she handled that is disgusting to me at this point.
Now, is this doctor still practicing?
Yes.
That's not okay.
Yeah.
Right.
Now, you need to report this doctor to the medical board?
Yeah. Yeah.
For bullying, medical negligence?
Mm-hmm.
Right.
That must be something you do, because my fear is these doctors, same as you, these doctors are still practicing and still hurting people.
Yeah.
Yeah.
So,
So she had the second shot, and almost instantly, within a week or so, she started having random shocks all over her body, electric shocks. And we actually took her to the hospital, and they were asking us.
They took me separately. The nurse took me, walked me around, and she was like, are you feeling depressed? How's school going? Is your family close to you? And was giving me a full psych evaluation when I came in for pain that I was having. And they ended up just sending me home, and I didn't get any help at all. And that's something that I deal with all the time is, if you go to the emergency room or regular doctors, they just treat you like it's all in your head. And that's horrific when you are suffering. It's the worst thing ever.
Her, so they didn't have a diagnosis. They sent her home. And she continued to have these shocks. She would get cold, hard muscles. Her muscles would get so hard, and I would try to massage them and rub them out, but her limbs would turn blue. Her legs in particular hurt really, really bad. Her hips and her knee joints were very, very painful. Her hands would turn black from loss of circulation. She would have rib cage that would stick out. You could see the bone sticking out.
why is that?
So it's costochondritis, and it was an effect of what was happening in her body. It would happen in her back as well, and she would get chest pain, like really bad heart pain. She would wake up at night with night terrors, and she would have drenching, horrific sweats. She would get really, really bad migraines and dizzy spells and fatigue that was so severe that she couldn't even get out of bed that day. Nausea.
Yep.
Wasn't eating. She doesn't eat. She eats probably 3 different things, and that's it. And
why? What happens? So what makes you not want? So if I offered you a cookie, what would you say? What would your body say to you?
I just never have an appetite. I never feel, I don't feel hungry, like I want to eat something. I feel the hollowness kind of like oh, I haven't eaten in forever, but like I don't actually want to eat anything, and like textures are weird for me. But there will be like 2-3 days that go by and I'll have like a snack of something, or it has to be a craving that I have, and then I eat a lot of that. But on a day-to-day basis, like meals, I eat probably dinner's my biggest meal. And it's scary for me because I'm like, what is going on here? I know that I should be eating, but like I'm just never hungry. So
And it's hard for us as a family too at mealtime because, we make a meal and we sit down together as a family, but we always have to make something different for Jacqueline, or accept the fact that maybe tonight she can't eat, and that's really, really difficult. So we were at a loss and we didn't know what to do, and nobody had mentioned the Gardasil shot, and so the psychiatrist said, I don't think this is psychiatric.
Oh, please stay away from psychiatrists.
I know.
Yes.
we do.
There's no place in
Yeah.
an injury.
No. So we stopped going that route, and I started looking up information, again, never thinking about Gardasil. And we heard about something called Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep. In short, that's PANDAS or PANS. And it was initially mentioned to us by her counselor. And a lot of times kids with strep, the strep actually crosses the blood-brain barrier, and it affects the brain and can cause symptoms like anxiety and night terrors and some of the things that she had, but it didn't explain the physical symptoms that she was having. So from that standpoint, they said, yeah, maybe she has PANDAS, and possibly she's had it probably even since the time she was a kid. So now we look back knowing what we know now, and we believe that the Gardasil vaccine just took that mild PANDAS that we probably never would have known that she had and just mutated it in a way that, those anxiety and those symptoms that she was having just kind of really went crazy. After we found out about the PANDAS, she was diagnosed with chronic Lyme. So now we found out that she has chronic Lyme disease. She has autonomic dysfunction, so she's having those sweats and the cardiac issues, and she has severe pain. She's got the ovarian cyst now that she never had before, extremely painful periods. The laparoscopy that she had to remove one of her cysts, they were ready to just send her home. Her pain was so severe she couldn't walk. Her bottom jaw would tremor. And you talk about ignoring something that is blatantly in front of you by a medical community. They literally looked at her and said, oh, she'll be fine. Just send her home. And we took her home, and my child screamed in pain for almost 2 days. And we finally took her back into the emergency room, and the emergency room doctor said that obviously she was in excruciating pain. She ended up in the hospital for another week on Dilaudid and drips because the pain was so severe. And so that's what the Gardasil vaccine has done, though. Something simple, that a laparoscopy that you and I might get and heal from and be able to walk out of the hospital with. Now for Jacqueline, her pain signals are that small fiber neuropathy that she's developed because of this Gardasil vaccine. Her pain signals are, I could scratch her and her skin will turn blue, because her body reacts to it differently now. And she's just very sick, and she's lost friends. She only knows one other person here in Columbus because...
Not anymore.
Right, yes.
I know, but it's been hard.
Never going to be alone again.
She's 19. She doesn't have her driver's license. She can't go to college. She had to be homeschooled in high school. Her old high school had kept her from going to prom 2 years in a row. She went through it and then some, because she was sick, and people didn't understand why somebody who's as beautiful as she is and looks as normal as she does could be so sick.
Thank you.
Yeah, could be so sick.
I'm worried about your father, your husband, with the guilt that he must be carrying.
It's horrible.
How's he doing?
Every time we talk about it, he cries.
Oh, it wasn't his fault. It truly wasn't. He was bullied.
Yeah.
Yeah.
By
Well,
the doctor.
I feel the pain that my parents feel all the time. My family feels. And that's hard, because I don't want what I'm going through to affect them. And to know that my dad feels that guilt, I tell my parents all the time, I don't blame either of them, ever. I blame the doctor that forced it on us, and, this was just a really hard card that I've been dealt. And my mom, she's my lifesaver. She's the one that, found out that I had Lyme and PANDAS, and she's, dedicated her life the past couple years to making me better and trying to figure out what's going on with me. And I don't think I would be this far in the healing process and everything without my mom. She's changed my life, and I appreciate my family so much, but it hurts me that they've been damaged by this as well. So it's been hard all around for everyone.
Oh, okay. These people want to show you how much they love you now. It's your turn for some love. Yeah, that speech, you did that. You're a very good speaker.
Thank you.
So that's why we're looking forward to having all these. This is love for you guys. See all the hearts on the right? Yeah, they love you because you know what? They can't bear to see this that's happened to you. That it's injured you and hurt you and your family. That love is for you as well, Mama.
Oh, that means so much.
Yeah.
Thank you.
It's like a veil has been finally lifted, and even with PANDAS, like Jacqueline was like, it doesn't feel right, and now she feels like she's a part of this community, and it all finally makes sense. And she now goes, okay, like I have there's other people like me, and I fit in somewhere. Oh,
that's amazing. Thank you.
We're family. That's right. We are family, guys. You're absolutely right.
So
when you say that. Did you sign the bus?
Not yet.
Not yet.
Right, so we're going to do the bus in a second. Okay, and literally, guys, they love you. They love you.
Oh,
Thank you.
Thank you, guys. Thank you so much.